This conference will now be recorded.
Good afternoon, everybody. Today we will be discussing a few topics in community ophthalmology. As far as your exams are concerned, these are very important topics. Definitely, you will be having some questions regarding these topics. So, the most common questions which are asked are: what is Vision 2020? What is National Program for Control of Blindness? And what is vitamin A deficiency? What is avoidable blindness? What is preventable blindness? What is social blindness, economic blindness? Such questions will be usually be asked in your viva and in your theory papers. So starting off with the topic, we will just go through each of this topic slightly in detail, so that you have an idea about what is this National Program of Control of Blindness, for the control of blindness, and Vision 2020. You must have come across this topic in your community medicine also, or in your SPM, but we'll be dealing with exclusively with ophthalmic point of view regarding National Program for Control of Blindness. So what is this program? What is its implications? What are its advantages? What are its outcomes? All those aspects will be covered. To understand this program, first we have to first define blindness. Okay, so now first of all, before we start a program, we have to first decide what we want to tackle. So you need to have some definitions or measurements regarding the same. Suppose you want to do something, say you want to travel from one place to another, you decide first the starting point and the ending point. So like that, in this particular program, what is the thing which we are trying to overcome? We are trying to overcome blindness, which is prevalent in the society. So what is the percentage of blindness which is prevalent in society, and what is the definition of blindness? First we have to assess that. So as per WHO definition, if the visual acuity is less than 3 by 60 in Snellen's chart, that is counting fingers 3 meters in daylight, inability to count 3 fingers, inability to have a visual acuity of counting fingers 3 meters, then it is called as blindness. So blindness is something which can be quantified. If somebody's best corrected visual acuity, in spite of all your attempts, doing refraction, examining the eye, everything you have examined, and finally the patient's vision is not improving beyond 3 by 60 or counting fingers 3 meters in broad daylight, that is blindness. So you have to know this definition. Now you want to know what you can do using this NPCB program. So for that, we have to go into some more definitions. We have to try to differentiate between visual impairment and blindness. If any visual acuity is less than 6 by 18, that is, it is 6 by 24 or 6 by 36, it is called as visual impairment. It can be low vision or blindness. It can be low vision. If the visual acuity is between 3 by 60 to 6 by 18, then it is called low vision or visual impairment. If the visual acuity is below 3 by 60, then it is called as blindness. So once we are clear with the definitions, we will go with the types of blindness. There are broadly two types of blindness: preventable blindness and curable blindness. Some blindnesses can be prevented. For example, vitamin A deficiency, which affects the cornea of the patient, of the child, it can be prevented by giving adequate vitamin A diet in the vitamin A supplements in the diet. But in case of trachoma, you can prevent the infection or cure the infection and prevent the complications of trachoma. There are some blindnesses which are curable. For example, cataract. Cataract causes decreased vision. So you can remove the cataract and place an intraocular lens. It is called as curable blindness. If the patient has corneal blindness, then corneal blindness can be cured by performing keratoplasty. You transplant the cornea and you try to improve the vision of the patient. So these are some examples of curable blindness and some examples of preventable blindness. Now, what is the magnitude of blindness in India? In India, majority of blindness, this is as per the survey by Government of India in 1999-2001. It's almost 20 years old, but it is almost near the same, somewhere around 55 to 60% as of now, which is caused by cataract. Around 12 million out of 45 million global blindness are present in India. There are recent surveys also, but almost the percentages don't vary much. So the major cause of blindness in India is cataract, which is around 60%, refractive error is around 19%, corneal blindness is around 1%, glaucoma 5.8%, posterior segment disorder or the retinal pathologies are 4.7%, surgical complications like following eye surgeries, it could be 1.2%, and other causes of blindness are 5%. So the major chunk is formed by cataract, and cataract is a curable blindness. Refractive error also you can cure. Corneal blindness to some extent you can cure. So glaucoma you can prevent its progression. So these are all some examples of blindness which can be tackled. So how does the government of India plan to tackle this? The program for that is National Program for the Control of Blindness. So the goals of the program are providing comprehensive eye care facilities for primary, secondary and tertiary level. The prevalence of blindness in India is 1.1%. That is, there are 11 blind people for every 1,000 people, and we want to get it down to 3 for every 1,000 people. So this is the main goal of NPCB. So you have to understand this goal. It's very important. The prevalence of blindness in India is 1.1%, and we are trying to achieve a target of 0.3%. So what we have done till now, first we have defined what is blindness, we have defined what is visual impairment. Now we have classified the various types of blindness, and now we are going into the program actually. And what is the goal of this program? The goal of this program is to reduce the prevalence of blindness from 1.1 to 0.3% and provide comprehensive eye care facilities for primary, secondary and tertiary levels. The program has been revised and again, and there are few more additional goals which have been added, or a few more additional objectives which have been added. Those include expanding the coverage of eye care diseases, eye care services, and to reduce cataract blindness, and development of blindness control units at each district level. Means they want to penetrate at the lowest level of the population or lowest level of the community. So everybody, it is right for everyone, right of everyone to have good care of health and good care. It is as per our fundamental right. It is right to health is our one of the most important priority. So it is a part of that right which we are talking now. So now what are the strategies of this program? Strategies include, currently there are 6 million, that is around 60 lakh cataract surgeries which are performed every year, and most of the surgeries are 95% of the surgeries include small incision cataract surgery or extracapsular cataract extraction with IOL implantation. And this is not only performed by government agencies and government hospitals, non-governmental organizations or eye hospitals have also an important role in achieving this target, because one of the goal is to reduce the cataract induced blindness. So what does this NPCB program do? For every cataract surgery which is performed, it under this program, it promotes it by giving 1,000 rupees per cataract surgeries, and it provides provision of assistance for treatment of eye diseases like diabetic retinopathy, glaucoma, lasers, corneal transplantations, vitreoretinal surgeries, treatment of childhood blindness, all these whichever associated eye diseases are there apart from cataract, for their treatment also it gives from around from rupees 1,000 rupees for voluntary organization and private practitioners. So it provides aid in the form of grants for performing cataract surgery to promote the progression of or to increase the cataract surgery rate. Now, to perform surgeries, we need trained people in ophthalmology, or we require ophthalmic surgeons. For that, there have been regional eye institutes have been established around. There are around 20 regional eye institutes all over India. So in these regional eye institutes and medical colleges, the ophthalmologists are trained and how to perform cataract surgery. They are trained in how to perform cataract surgery and given good surgical exposure so that they perform their services in the community. Apart from the surgical services, many require glasses, spectacle correction, screening of diseases. For that, vision centers have been established in more than 3,000 PHCs all over India, and for each PHC, a paramedical ophthalmic assistant has been deputed who screens the patient. He screens the patient and he screens for any decrease in visual acuity, and then he refers it to the appropriate center for further management. So this is as far as curable blindness and preventable blindness is concerned. And under this program, number of eye banks also, establishment of number of eye banks also has been promoted. In the present plan, NPCB reimburses rupees 2,000 for every pair of eyes which are collected, and rupees 25 lakh for established government eye banks for buying equipment and development of infrastructure. So it promotes establishment of eye banks. Now, what do these eye banks have? They have corneas. So these corneas, they store the corneas. These stored corneas are useful for providing for performing corneal transplantation and cure the corneal blindness. So that is why eye banks are required. For under this program, there is promotion for establishment of eye banks. Apart from this, we require to develop various human resources who work for, and who assist. It is not enough only if you have ophthalmologists and ophthalmic technicians to perform this, the various duties or various procedures under ophthalmic setups. So you need at a school level, you can train the school teachers, you can train the medical officers, so that the referral becomes easier. Every time you don't have to go and perform whatever is necessary to be done at that particular level. And using the print, electronic and social media, awareness is created regarding eye health. So how to maintain good eye health, how to identify various conditions, who is at risk. Say for example, a patient with diabetes needs to screen his eye regularly. So that is promoted through IEC, information, education and communication, using the print, electronic and social media. So till now, how many 5-year plans have been completed? Now 11th 5-year plan is recently completed. Now 12th 5-year plan is going on. So what are the achievements which have been seen in 11th 5-year plan? In 11th 5-year plan, around 2 crore eye cataract surgeries have been performed in the government as well as NGO sectors. So 94.6% of the cataract surgeries were performed with intraocular lens implantation. So on an average, 29 million cases have been 2.9 million cases have been performed. So and around 27 lakh spectacles have been distributed, and successful eye donations around 2 lakh eyes have been collected. This is during the 11th 5-year plan which I am talking now. Now at present the 12th 5-year plan is going on. So training of around 1850 ophthalmic surgeons has been completed during this tenure, and strengthening of eye banks, around 82 eye banks and 177 eye donation centers have been developed. Eye wards have been developed in Northeast region. NGOs support has been implemented. Teleophthalmology, 27 teleophthalmology units have been implemented in various states. Now, what is this teleophthalmology? Teleophthalmology is somebody sits in a vision center, he is provided with a fundus camera or an anterior segment photograph unit. He takes a photograph of the patient, documents the vision, and mails it or sends it to a doctor who is sitting in the regional eye institute or in a medical college. So patient doesn't have to travel all the way till the medical college or to the regional eye institute for minor problems. If it is a serious problem only, he will have to travel to the major institute or the higher center. So most of the cases will be solved or treatment will be given by this teleophthalmology, which has been implemented in various states. And vision centers, around 2,298 vision centers at various PHCs and CHCs have been developed. What are the new, apart from these, there are some new initiatives which have been included in the 12th 5-year plan. So distribution of, what are those? Distribution of free spectacles for near work to old persons suffering from presbyopia, development of multi-purpose district mobile ophthalmic units, around 400 have been approved, and tele-ophthalmology has been given a facelift until by linking various ophthalmic consultation units in the medical colleges and regional eye institutes. So this is one main focus or an improvised form trying to be implemented in the newer version of in the 12th 5-year plan, apart from the regular things which have been going on in the various 5-year plans. Now, how to achieve this? Whatever these goals are there, fine, we have seen whatever things have been done in 11th 5-year plan, and we have seen what is the thing which is being trying to be implemented, which is trying to which is being implemented or which is being upgraded in the 12th 5-year plan. There should be a plan to achieve this. For that, what is required? We require various infrastructure, services, and specific programs and education. So these are the main prongs of approach to achieve this NPCB program. What is the infrastructure? Infrastructure, we have Apex Institute, like RP Center, like AIMS, which is present in New Delhi, primary eye care, secondary eye care, tertiary eye care. So primary eye care is peripheral center or example PHC, secondary eye care is district level, tertiary eye care is medical colleges, Apex Center is RP Institute. These are various types of infrastructures which needs to be developed. So for example, primary healthcare should be equipped with vision centers so that basic level of screening and prescription of glasses just finishes off. Their patient doesn't have to travel all the way to the city or the district to just for the sake of glasses. Secondary eye care, some basic cataract surgeries and minor procedures can be performed. Tertiary level or medical colleges, advanced procedures can be performed. So all these places, medical students who are doing post-graduation in ophthalmology are trained to perform various surgeries and eye-related cases. So what services which are required to be implemented under this NPCB program? So main services which needs to be implemented are refractive error screening, medical and surgical treatments, maybe it may be for cataract and other eye related diseases, rehabilitation, school children visual screening. These are some services which needs to be included at various levels. Now, there are specific programs which have to be implemented under NPCB. Those include trachoma control program, school eye health services, vitamin A prophylaxis, occupational eye health services, World Bank assisted cataract blindness control program. So these are some specific programs which are given upthrust in under the NPCB program, which go on hand in hand along with the 5-year plan which is implemented by the government. So trachoma control program was launched in 1963. The goal is early detection and treatment of trachoma because it causes blindness. So what is the treatment you have to give? You have to follow the SAFE strategy. SAFE strategy is nothing but surgery, antibiotic, facial hygiene, environmental changes. So these are some this is the strategy which is used to control trachoma. So, environmental hygiene, facial hygiene, antibiotic. If some complications develop, surgery is required. And topical tetracycline and ocular hygiene are the main prongs of approach for the cases of trachoma. That is as far as trachoma is concerned. As far as vitamin A prophylaxis is concerned, you want to prevent corneal blindness caused by vitamin A by giving oral vitamin A, that is 2 lakh international units of vitamin A orally at 6 months interval between age of 1 to 6 years. If the age of the child is less than 1 year, you go with 50% of the dose, that is 1 lakh international units. So every 6 months you have to give 2 lakh international units. Eye health education, as I have already discussed, everybody should be made aware of how to maintain good eye hygiene and good eye care. You can use various medias, social medias, print medias, videos, audios, radios, teachers, social workers. All these people will help you in improvising the awareness regarding eye health. The next thing, most important question which is commonly asked, till now we have discussed mainly about NPCB. You have to discuss all these points under NPCB. It can come as a 10 marks question also, it can come as a 4 marks question also, it can come as a 2 marks question also. So it is a definite question. Usually a question will always be asked in NPCB. Now coming to Vision 2020. Now we are already in 2020. This was implemented long back by WHO by an international agency for prevention of blindness and in coalition with international NGOs. They are trying to achieve or try to eliminate avoidable blindness by year 2020, which we couldn't achieve as of now, but we are in the process. So that was the goal which was formulated long back, around 15-20 years back. So the main slogan for that was the right to sight. So the right to sight was the slogan, and it was a global initiative for elimination of avoidable blindness, that is in which includes both preventable and curable blindness. Preventable includes your trachoma and vitamin A deficiency. Curable includes cataract and corneal blindness due to, for example, vitamin A deficiency. So under Vision 2020, what are the diseases which have been identified which will reduce the intensity of blindness prevalent in the community? So these are the 5 conditions which have been identified in Vision 2020. One is cataract, second one is trachoma, third one is onchocerciasis, childhood blindness, refractive errors, and low vision. So these are some 5 conditions which have been identified under Vision 2020. So please remember these 5 conditions: cataract, trachoma, river blindness, childhood blindness, refractive errors are some main conditions which have been identified. They will ask you, is diabetic retinopathy and glaucoma included under Vision 2020? It is not under Vision 2020. It is under the Vision 2020. These are the 5 conditions. The original document includes only these 5 conditions, which are mainly preventable and curable blindnesses or avoidable blindnesses. So, what are the strategies under Vision 2020 which have been implemented or which have been planned to be implemented under Vision 2020? So first, target diseases have been identified which can be prevented and controlled. These are the 5 target diseases. So disease prevention and control. For that, you require adequate human resource development. Human resource development includes mainly training of personals, like we require people who are trained in ophthalmology or ophthalmology related conditions, strengthening the infrastructure, like personnel mainly includes ophthalmic assistants, ophthalmic surgeons, nurses, etc. Strengthening of infrastructure mainly includes strengthening at primary level, that is PHC, strengthening at secondary level, community health centers, strengthening at tertiary level, medical colleges and apex institutes, resource mobilization, use of appropriate technology, say for example teleophthalmology, where all these processes are aimed at decreasing the prevalence of blindness. That is, which type of blindness? Avoidable blindness. Avoidable blindness mainly includes preventable and curable blindness. So this is the main key for these programs. It is mainly to reduce the avoidable blindness. So what is the infrastructure pyramid for under which the Vision 2020 has been planned? It includes all these multiples of 2 and 0. Okay, so under this program, they have planned to have, say, let's take for example India. Each country should have primary level of vision centers, around 20,000 vision centers, and for which there should be 2,000 service centers which will tackle common problems like eye care problems and which will handle cataract surgeries. And then above that, at least there should be 200 training centers which will take care of training ophthalmic surgeons and ophthalmic technicians. And above them, there should be center of excellences, like for example apex institute like RP center, Rajendra Prasad Institute in AIMS, which is an example of center of excellence where most complicated cases can be handled. So this is the infrastructure pyramid under which the Vision 2020 functions. So this is the program which has been laid down by the Vision 2020 for tackling avoidable blindness. So with this, I just complete community ophthalmology 2 basic questions which are commonly asked for you. National Program for Control of Blindness and Vision 2020. So this is, please go through the textbook and read this particular chapter. If you have any queries, you can always come back to us. So with this, I end my class. Thank you. Anybody has any queries, you can ask me. No queries, so then I will stop the recording.